Get started. Good morning, everyone. Welcome. Happy Friday morning, and welcome to the Linkages 2.0 CalWORKS and Child Welfare Collaboration Relaunch webinar for new counties that are interested in joining the Linkages project. So I'm Stuart Oppenheim. I'm with the Child and Family Policy Institute of California, and if you've at any time been involved with Linkages, you know we've been involved with Linkages since almost the beginning, and I'll give you a little bit of that history. So Leslie Ann, you want to move it to the next slide? So just some friendly reminders that everybody, this is a webinar, and those of us who are used to Zoom will be a little surprised on the different way that things are handled. So participants are automatically muted throughout the webinar. We have a team continuously chatting, monitoring the chat, also probably continuously chatting, but that's another story. Anyway, if you have questions or comments, please put them in the chat. And I see that folks are already doing that. So thanks for that. And Roxanne and I will be monitoring that and either forwarding the questions to the presenters or responding in the chat, or if we don't get to all the questions, we'll get some communication out to everybody after the webinar. And this presentation, as well as the renovation assessment tool, will be sent to all registrants after the webinar. And since you all just got a request to verify that you're okay with it being recorded, you probably know that this is being recorded. So we'll also share the recording with everybody. So next slide, please. So this is, again, focusing on new counties, though I know we do have some folks here who probably are in counties that have done some form of linkages in the past and may even be involved in doing linkages now, but you're welcome to be here. We had a great turnout for the focus on existing counties earlier this week, and we've got a great turnout today. So we're extremely pleased that the relaunch of Linkages is generating the kind of interest that we had hoped it would. So with that, I'm going to give a little bit of a background of the history of Linkages. So Leslie, anyway, Leslie, I think you can just put all the animation up. And so join me in a little stroll down memory lane. And soon after TANF was passed, and that was passed in 1997, one of our California foundations, the Stewart Foundation, learned about work in Colorado where one county was using TANF funding to support families who were also in the child welfare program. Sort of a new innovative approach that was permitted under the four purposes of the TANF legislation. The foundation thought it was interesting enough. They sponsored a site visit of CDSS staff and some select county staff to go and see what was going on in Colorado, what we might be able to learn from and possibly replicate in California. So the folks from the site visit came back and set up a work group to explore how to bring this concept to California. They were extremely pleased, extremely interested in seeing what we could do in California, knowing that our state plan was somewhat different than Colorado's state plan. They still thought that there were things that we could do within the context of the California TANF state plan. So in 1988, 89, they set a vision for the work, and that vision was grounded in two facts. One, that poverty is a risk factor for child abuse and neglect, and that families with annual incomes below $15,000 at that time, compared with families with annual incomes above $30,000, were over 22 times more likely to experience some form of maltreatment. So with that vision guiding them and continued funding from the foundation, they launched a planning phase. They brought work groups together to work on various aspects of what became the Linkages project, and did that planning in the years 2000 to 2002, resulting in the start of a pilot phase where select counties were volunteered to help test the things that have been developed in the planning phase. And that pilot continued and was at that point transferred to our organization, Child and Family Policy Institute of California, from another organization. We had been incorporated in 2004, and they thought we'd be a great home for this project. We took it on with those counties and then added an additional counties. So we were up around 20 counties in the second implementation phase in 2005. As foundations are wont to do, they said, well, you know, that this seems to be a successful project. Counties are jumping on board, the state's endorsing it. If it's that valuable, then possibly public funding ought to take over from where foundation funding had been. That foundations don't invest in permanent programs, they invest in testing so that they can move on. Fortunately, we didn't have to go to either the counties or the state. We discovered that there was a federal grant opportunity. We competed for that and were successful. So from the years 2006 to 2011, we deepened our linkages work under the auspices of a federal grant. And that helped us really cement the work of the large number of counties that were working with us. At some point, I believe we got up around 30 counties that were actually working on linkages. When the federal grant ran out, the State Office of Child Abuse Prevention, under whom we were operating, through whom the federal grant came to us, decided that yes, it was a good program and they would continue funding it. And they invested another 3 years in linkages development and sustaining the work of the counties. When that funding ran out, the CWDA Self-Sufficiency Committee invested in another 2 years of funding. So we've gone from 2000 to 2016 with various kinds of foundation and public funding. But unfortunately, at the end of 2016, the funding sort of ran out. For those of, if any of you were involved, we had a farewell voyage on the Queen Mary, our final conference. It was a bittersweet event, celebrating the 16 years of work, but also sad that we couldn't continue the statewide work. Since then, and after 2016, a number of counties continued working on their own. And since 2016, without statewide support to help maintain and support and stabilize their programs, they have continued on. And one of the people who's on our team and we'll introduce later is Roxanne Stevens, who was instrumental in helping to keep the counties that without the funding to help keep the counties moving forward. So that was great. But then over the course of the last 2 years, the California Department of Social Services has been working to revive a statewide approach to linkages, beginning with work with the federally funded Capacity Building Center for States. In December 2019, the state sought support from the center to help assess the current state of linkages implementation and potentially revamp and promote the deeper implementation of linkages going forward. In March of 2020, the state convened a kickoff meeting, which led to the formation of the Child Welfare CalWORKS Coordinating Work Group, whose work has really culminated in the work that we're doing today and this week in the relaunch. And as part of that commitment, the Department of Social Services has provided funding to our organization, CFPIC, starting on January 1 to oversee the work to implement Linkages 2.0, building on the past work, and really today, this week, kicking off with these webinars, the work with counties to move linkages forward into what we're now calling Linkages 2.0. So thanks for indulging me on that little bit of a stroll down memory lane, but it's helpful for us to know that linkages is not a new idea. It's not really a new initiative. It really is a program that benefits from statewide support. And that's what we're going to talk about today. So our goals for today's webinar are that to help you understand what the relaunch of linkages is all about, to understand the value of assessment and planning as essential for the establishment of your linkages program, to help you be prepared to use the readiness assessment tool and recognize how it guides planning for your linkages program, and so that you can learn how to access new supports available to linkages coordinators and implementation teams. So with that, I'm going to welcome our linkages partners at CDSS. And on the slide, you'll see Lisa Witchy, who's the chief of the Integrated Practices and Resource Development Bureau, Children and Family Services Division. Not here today, but really one of our state champions who we really want to celebrate is along with Lisa, is Damian Ladd, who's the chief of the CalWORKS Engagement Bureau. But in his place, and equally committed to supporting you and supporting us, is Christina Meza, the branch chief of the CalWORKS and Family Resilience branch. So with that, I'm going to turn it over to Lisa and Christina and ask you to say a few words.
Great. Thank you so much, Stuart. And it's so interesting to hear the long history around linkages and understand, a lot of the reasons that the linkages work started and really made sense for us to pursue in California still really makes sense for us. It's a model of coordination and case planning that allows these two really important programs to work smarter, not harder, and to do so in a way that makes things easier for kids and families. So I am just so excited to be at this place where we are relaunching the Linkages 2.0 model. Just super excited. One of the things that I want to point out that I know we're going to talk in more detail about is the prevention focus that this new model takes on. We really wanted to look from a prevention-oriented lens and make sure that our coordination efforts are really leveraging the CalWORKS and family sustainability enhancements that have taken place since the initial linkages work. And I think that you'll all be really excited to see how we're planning to structure that as well, so that we're able to support families in staying together and growing stronger together. So with that, I will pass to Christina for a few remarks as well.
Thanks so much, Lisa, and I'm really excited to be here supporting Damon. So I see many familiar faces in the attendee list. Christina Meza, I'm the chief of the CalWORKS and Family Resilience branch, which includes the bureau that is supporting a lot of the linkages work. I just would reiterate everything that Lisa shared, especially that piece on the focus around prevention. Given so many of the different economic supports that we're able to provide families through the CalWORKS program, and making sure that those that the work that we do through linkages really focuses on that support in that prevention space through family stabilization, as well as some of the other economic and workforce related supports that we're able to offer through CalWORKS. I also want to offer just another plug in different spaces outside of our Welfare to Work team and our Engagement Bureau team. But we also see linkages and some of the opportunities that exist through our CalWORKS Home Visiting program, which just launched a few years back. We just wrapped up our evaluation of that program, where we spoke specifically to work like linkages in the space of prevention for our families. And that evaluation report is now live on our webpage as of January 10th. So really excited to get that effort out after 3 years of working in that evaluation space. But in addition to the home visiting program, we also have our CalOR and our refocus on the importance and significance of outcomes when we work with families, and making sure that we are focused on what is best for the family versus some of the traditional practices that we are used to in the CalWORK space, like hours of engagement. So a lot of work happening in that CalWORK space as well. But really appreciate being here, really excited for the many opportunities for the counties, prospective counties who are on the line today. And of course, the work that we've been able to do so far with the group that's with us this morning. That I'll turn it back over to the team.
Great. Thank you both, Lisa and Christina. Those are great remarks. And it's just so wonderful to have this partnership with the department, and that you are such great champions for this work. So I'm going to just mention who's here from our team. We have a great team at CFPIC, really committed to supporting linkages, as you know, as we've been since 2004. So again, I'm Stuart Oppenheim with CFPIC. And with us today for our team is Dana Fabella, who's the Linkages Project Director at CFPIC and has been with the program since she joined our organization shortly after Linkages joined. Leslie Ann Hay, our Linkages Project Consultant, who actually, when we inherited the program, I went, now what do I do? And I realized that Leslie Ann had been working with in the previous phases, so she was my go-to person. And when Dana started, and I asked her to be the project director, she was a little kind of the same. What do I do? And I said, "What? You're okay. Leslie Ann's here." So anyway, Leslie Ann has been with the project since the beginning. And Roxanne Stevens, who I also previously mentioned, who was with one of our counties and is now a project consultant with one of us and has been instrumental in keeping the flame alive. And Mia Stizzo, our Linkages project support person, who is the person who keeps all of our flames alive. Our magical assistant who makes us look good all the time, even when we're not so good. So anyway, that's our team. And I think I turned it, let's see,
Yep,
I think I turned it over to Dana to talk about the agenda.
Yeah. Yes, it's really been a privilege to work on this project, and I left county work only when Stuart dangled the Linkages project in front of me. Before that, I was working for a county in child welfare. So this is I think a really great project, and I'm going to steal from my LA folks who used to say their mantra was it just makes sense, and it really does just make sense. So how are we what do we plan to do today? So we'll talk a little bit about the new vision. You heard about where we've been. We're going to talk about where we're going. We'll talk about the statewide support for linkages, what we're envisioning, and of course we'll be working with the county coordinators to even build that out to make sure that we're meeting the county's need. I mean, our whole focus for any of the webinars and any of the work we do are to support the work at the county level. And we're going to talk a little bit about linkage coordinators, what that is and why we see it as so important. Then we're going to take a quick stretch break. We're going to let you do a stretch. And then Leslie Ann Hay is going to launch into the assessment tools and talk about what it takes to launch linkages. And then we'll talk about some next steps. So with that, what's our new vision? Now, you heard a little bit about where we've been, and any of you, I think there are some folks on this call that were a part of the former iteration of linkages, but linkages really had, and go ahead and you can move the next. Oh, okay, so under that 1.0, Linkages 1.0, what Stuart was talking about, that really was focused on coordinated case planning between when there was a welfare to work worker and there was a child welfare worker. And so those would be either in a family maintenance program or in a family reunification program. Now, we're not saying we're not going to focus on that and support that. We think those are very important collaborations, because if you have a family that is on CalWORKS and was part of welfare to work, now it's not just part of welfare to work, it's part of some other program, possibly in CalWORKS. We want to make sure that coordination happens. However, that bottom thing, and we made it purposely larger, we're really expanding. We want to look at what's happening, and it's exciting even when you hear what the branches are called. Family resiliency is what Christine is from, and family engagement is what Damien is from. Well, those didn't exist back there. That was not the thinking. It was really work first kind of thinking. And so the supports that they've added in that program, as well as where child welfare is moving, really lends itself to us thinking about linkages in a very different way. So we had the opportunity over the last 2 years, and COVID did not stop us. We moved to Zoom meetings to sort of think this out with the folks that were on that collaboration team. So go ahead to the next phase. So when we talk about shifting and expanding it out, kind of what do we mean? Now, as we said, the original linkages concept was really around when you had a mutual case, when child welfare and CalWORKS had a mutual case that was a case management kind of case, a welfare to work case. So what we wanted to do, and we are doing, is aligning linkages with a prevention framework. Now, any of those folks here that are on the child welfare side, you know that what they're talking about is the federal family preservation, having to, create prevention plans. So we wanted to align our program because we think that this is a very important program, and that aligning it with our partners, the child welfare folks and the CalWORKS folks, you really have a nice continuum, really you do. And so we're emphasizing early intervention as a key component for supporting families and keeping children safe. And you heard Christina talk about their home visiting model. It was exciting. I sat in on the webinar that they had around the evaluation, and my mind was just clicking all along, thinking about, wow, this is perfect timing as they've created that program, because it really is an early intervention program that is in the other. For child welfare, it's the other side of the house. They're doing a lot of that prevention work that the child welfare folks don't even think about. So we really want to have us thinking about what is it we can do, both child welfare and CalWORKS, to make sure that these families are not having to come into child welfare and have a case open, but to be able to keep children at home safe. So all these where CalWORKS was going, where child welfare is going, it really presented an opportunity for us to think about linkages and linkages program innovations. What could we do? What could we do differently to sort of capitalize on the shift in how both CalWORKS is operating and child welfare is operating? So our prevention framework, is really around primary, secondary, and tertiary. So primary is sort of universal programs that target an entire population to provide support and education before problems occur. And in our model, in our linkages model, that population is the CalWORKS population for us. That's the entire population. And we know that there's a risk factor. Why? Because Stuart told us that, I think it was 22 times more likely that they would come into child welfare if they were below, I think it's 15,000. So we know that there is a risk factor. So that whole CalWORKS population that we're hoping to provide support and information to is part of the strategy. And you can go ahead and put the next one on. So one of the things that we have a subcommittee that is working on it, or a work group, the prevention and linkages prevention and early intervention work group, which Stuart facilitates. And that work group really has just completed, and we're in the process of evaluating it and having the folks that are on that county folks on that committee kind of look at it and test it out and let us know what they think about it. But we're looking at material that really looks at family protective factors. What are the 5 protective factors that are really important? So we're using that as one of the universal tools that we're hoping that our linkages counties will help us think about how to best distribute. Under secondary, those are programs that are targeted at families in need to alleviate identified problems and prevent escalation. So Christina brought up, their home visiting program. There's also their family stabilization. There's intensive case management, and in the child welfare side, on the you've got referrals coming in, and that emergency response workers may be going out. So what kind of coordination can we be doing early on with our CalWORKS before they become a case? There may be work. So we see that as sort of a secondary early intervention. And of course, many counties have differential response programs, and those are responses where they coordinate and collaborate with a community partner to provide support and services before they have to make it a child welfare case. So in our framework, those are really what we call our secondary responses. Tertiary, we know, or that's where we were focused. That was where Linkages 1.0 really was focused in that bottom area for FM and FR cases when there were CalWORKS cases that were open. And so we're not, as I said, those are important families to make sure we coordinate. And under a recent piece of legislation that was in the last year's trailer bill, it will also allow not only services, but now a grant to go out to a family if a child is removed. So we'll be working, looking at how that works in our program as well. So with that, let's see, we are on, you can go ahead. So I'm going to turn it over to, as Stuart said, the person who has the longest longevity with linkages on our team, and that's Leslie Ann Hay. Go, Leslie.
Good morning, everyone. I'm so happy to see such a wonderfully huge crowd here today. And so what I was hoping I could just tap into a little bit here is, share with you all, because I know it's hard for you all to know who's out there, and let you know who came to the webinar today and who's wanting to learn more about how to either establish or perhaps reestablish their linkages program with that long history that Stuart so nicely laid out earlier in the webinar. It's clear that there's many counties who have really never explored the collaborative effort between child welfare and CalWORKS in any sort of formal way. And then there's many counties who have done so in the past in some time, but perhaps, the momentum has pretty much diminished over the years for various reasons. And so it's wonderful that you're all here today to kind of, either establish linkages for the first time or reinvigorate a program that that has maybe died out in your location. So, we had 85 folks register, and we've got 28 counties represented in our audience here today, as well as our partners from the state and CWDA as well, and even some county partners. I think maybe some of those community-based organizations that Dana mentioned are here from some of the counties. So we really have a wonderful wide representation from all over the state. And many of you have anywhere from 3 to 6 individuals from your county. So I think you're starting to even think about forming your teams and starting to come together and really reflect on how can we get linkages going in our location again. So I wanted to just take a moment, and Mia's going to help us out with this and dive a little bit deeper into who's out there in our audience. And I wanted to just ask and not make assumptions, just the simple question of has your county ever had a linkages program in the past, right? And just go ahead and respond either yes or no. If you don't know, that's fine too. You don't need to guess. But go ahead and see if you know whether your county has ever had a linkages program in the past, and we'll have Mia collect those responses for a moment here, and then we'll show what that little survey says. I think we'll get some results here. Okay, so we're almost split half and half here, right? We've got a whole lot of counties, as I mentioned earlier, almost 60% of you who've had linkages up and running at some point, right? And now you're just really looking to try and breathe some life back or start over, or really think about reflecting that. And others of you have never done that before. So I think the rest of the tools and the support that we'll be providing today will really help either one of those situations move forward. And the second question we wanted to ask you is, with all the staff movement that happens in both our programs, we wanted to ask, just for you personally, right? Regardless of whether your county has ever had linkages program in place or not, what is your personal experience with linkages? Are you brand new to linkages? Have you maybe been involved with linkages in your county in the past? Or are you currently involved in trying to breathe life still into a fledgling start at linkages? Or perhaps you've had experience with linkages in a different county. So go ahead and mark your choice on that question, and we'll see what our audience distribution here is on that. It's interesting. It's great to sort of bring experience from other counties. If some of you are moving jobs sometimes across neighboring counties, it's great to share those experiences. between your peers and take those great ideas from one environment to another. And also, reinvigorate some things from the past. So this is great. We've got well over half, close to 2/3 of our audience here who's brand new to Linkages. So that's wonderful that we're not only expanding the program, but we're expanding the folks that are going to be familiar with it now over the next several months. So a few of you have some experience in the past as well. And that'll come in very handy, I think, for all of you to draw on today. So with that, I want to go ahead and we'll turn it back. Let me say one more thing here in terms of, one of the things that we like to always both remind ourselves of and help to orient new folks into linkages around. And these things are still very true for the direction that we're taking linkages with prevention as we go forward. There's really some key ingredients to an effective linkages program in your county to be able to collaborate effectively, whether that's with common cases that you might have shared across the programs, or if it's simply a family that you can help by coming together before they rise to the level of the case, particularly on the child welfare side. And so I'm just going to quickly run through these key ingredients that we've really found over the years to be central elements to have in place for a successful linkages program. And one is that shared vision of linkages. Linkages is not a one size fits all kind of a program. It's something that's very unique about it. While we have some common elements to linkages, it's something that really gets designed locally in each county to really fit your target population, the kinds of needs that your families exhibit, and the kinds of resources that you want to bring to bear around that. So having that shared vision between CalWORKS and Child Welfare Services, all the way from the top down, about what kind of a linkages program do you want to put in place and what does that look like for your location, is really, really important starting point. And then having that consistent, visible commitment from your leadership at the top, just like we had Lisa and Christina and Damien, doing that at the statewide level. That's really important to model that at the county level as well. And having a way to sort of accurately and systematically identify who are the families that are going to benefit most from our linkages effort, and being able to identify those families easily and engage them in that process of collaboration. And having deliberate service coordination between Child Welfare Services and CalWORKS is another key ingredient. And now that we're all in California over the last few years, really moving more toward a teaming model, I think this is even more well reinforced, both in CalWORKS and in Child Welfare Services, with child and family team meetings and the kinds of family stabilization and focus on case management that is happening on both sides of the house. Another thing that really helps create a robust linkages program is to jointly train your workforce, right? One of the things we really want to try and combat in this collaboration is working and building knowledge bases in silos, right? And so one of the things that we've developed over the years are some great opportunities to, bring both sides of the house together for learning opportunities, to share knowledge. And again, not to do each other's jobs by any way and by any stretch, but to really become familiar with what the roles are across the aisle. And so that it really supports that teamwork in an effective way. And of course, leveraging resources is so critical to, bringing families together with everything that they may be eligible for through their involvement or their potential eligibility for all of the many resources that both CalWORKS and Child Welfare Services provide. So being able to be aware of what those are and how to bring those to meet families' needs is important. And then sharing accountability as well. One of the things that we see when linkages programs really start operating effectively in counties is that, you know, there's a real shared view of, you know, making sure that the goals of each program are really attended to by the protocols that you're using for your collaboration. For example, you're coming together and you're making sure that economic self-sufficiency is equally important for this family's well-being, as is family stability and child safety on an ongoing basis. So it's really blending that together at the team level, which is something that families struggle with all the time, right? They have that expectation to meet all of those requirements, but often not the support in a coordinated way to be able to do that. So that's why our final key ingredient is just so critical, which is that robust communication between child welfare and CalWORKS and other stakeholders who you may be involving in the service to your families. You know, we can't collaborate well unless we know what's happening. We know what changes are happening for the family. We know what new resources might be available to meet their needs, and have that constant cycle and feedback loop going on amongst the team. So with that, I want to turn it back over to Dana and to talk a little bit more about the kind of supports that we're starting to rebuild across the state for your efforts at the county level.
Thank you so much for that, Leslie Ann. And yes, so one of the things that, you know, we're just listening to the history and knowing that history, having been part of most of the history of linkages, one of the things we know that has been so missing is that statewide support, because you all have been, many of you that have been continuing to work on your linkages, you know, and actually Leslie Ann will share some information a little bit later, but we know that it's been a struggle. It's because linkages is not mandated. That's its strength, right? And it's also its weakness. One of the things is because it's not mandated, everyone at the county level and the state start looking at what's the mandates, what do we have to do? Linkages really is the best practice, and it's the best way for one to be able to serve the families in your community by the collaboration and coordination of these two great services. So our statewide support that we're looking at right now, and as we're moving forward, is our CDSS partnership. They're really on board, as you heard from Lisa and Christina. This program really is supporting the strategic direction of both of these services at the state level. One of the things in the past, the outcomes that CalWORKS had was really around welfare to work, their work participation. Right now, they have outcomes now that they're looking at around family stabilization and engagement. So those are the same kinds of work that child welfare is looking at. And child welfare is moving towards looking at more prevention. And, you know, how do we make sure that these families, you know, don't have to have, be removed from their children be removed from their family. So we have the support at the highest level at CDSS. And so we're so pleased with that. So that support is going to continue to help us move linkages at the county level. We have an oversight committee that is actually, or an advisory oversight committee that is now just being formed. Both CWDA Self-Sufficiency and CWDA Children's Committee have volunteers, as well as state level staff that are going to be on that oversight. We're going to be, our first meeting will be in April as we start looking at what do we want that oversight committee to do? How do we want it to support your work at the county level? A linkages toolkit. Now we have a linkages toolkit, what we call our first iteration or 1.0. So we are now upgrading and developing a linkages 2.0 toolkit, and it is a work in progress, and it'll be the toolkit will now mirror what we're looking at in terms of prevention, early intervention, and tertiary. So that's in progress, and that'll be a tool that, you know, we'll, as we start working with you and we help you develop your protocols, we will then feature those protocols on our toolkit so others can share. Learning collaboratives, the thing that I know from being part of a county for almost 30 years is that we learn best from one another, right? Counties learn best from other county staff. You know, what are their innovations? What are they doing? How are they doing this? So what we're planning is to have ongoing webinars. We are going to be developing peer interest groups because, as we've said, depending upon your target population, who you choose to start working, what population in your county, you may have another interest, a different interest than maybe the county next to you. So what we'll do is look at what are the counties, what's their target population, what are they interested in learning about, and we'll develop some peer groups that you can have folks that you can that we can bring together to problem solve with you. We'll have an annual convenings, at least one a year, where we bring everybody together. We do some presentations of the work going on in the counties. We also use a newsletter. We'll reestablish our Keeping Linked newsletter, where we tell you maybe what's going on in the county next to you. You don't really know. So we'll feature some linkages stories, so you'll keep you all in the loop with one another. So that brings me to talk a little bit about linkages coordinators, why I feel that they are very important and why we really insist upon you having linkages coordinators in your county. Let's do the next slide. They are an essential role, and all of you are used to the state saying, okay, who's the point of contact, or we call it the POC, for whatever project is going on, because they can't call 50 people. If you need to get information out, you need to know who that person is. So we really need somebody at the local level that really is what we call a coordinator for the local practice, to know what's going on in your practice, and to also from a statewide perspective, who we can reach out, who we invite, and leave it up to you as a coordinator to invite whoever on your team you want to be at whatever webinar that we're developing. So one of the things that we know that and this is from how many years, many years of experience, we know that if you've got a large agency, a medium or large agency, we know that your programs are very siloed. You've got CalWORKS over here, and you have child welfare over here. We know that you really do need a representative, a coordinator on each what we call side of the house. If this is going to be effective, it cannot be seen as just a child welfare program, and it cannot be seen as just a CalWORKS program. This needs to be a program that is really a collaborative program, and that is exemplified by the fact that there is a lead person in each one of those programs. Now, experience also tells us is that some of those very small counties, they just don't have the bandwidth. They don't have, they're not, they're actually bumping into each other in the same building. So they don't have, the same kinds of coordination and communication issues that large counties have. So it may be that just one person from a smaller county can represent both programs, but we'll talk to you and work with you as on that issue as we move forward. But we really would want the county to designate a coordinator on each side of the house, or each side of the aisle, I think, as Leslie Ann put it earlier. And why is that? What do they do? Why are they so important? Well, they are a point of contact for the county. So, when we're reaching out and letting you know there's a webinar, we don't know in your county who we're going to send it to. We leave that up to you in your county. So you become the point of contact. And you really do gather and you share support resources with your staff or with the staff in that county. So we'll be sending out material. We'll be, best practices all the time. And you also will be our point of contact around who, when you've got some resources you might want to share, or you have a new protocol around a particular population, we want to know about that. And we want to make sure that we have that information in our toolkit so that other counties can sort of look at that and learn from your what you've been doing. And then, of course, one of the things that we've known from our experience is that coordinators, one of the things is no one else is doing this in their county. So they become sort of isolated. So they really like having those peers coordinators in other counties that they can reach out to, provide examples and share with one another. It also, your job, we see, it has guiding your implementation team. So whatever, when I talk about an implementation team, whatever protocol or whatever target population you decide your county wants to sort of focus on, someone needs to be in charge of who's doing what. Is it happening? So it really does guide, the coordinator guides that implementation team to keep you on track. You know, if you don't have deadlines, if you don't know, if no one's, you know, being accountable for the implementation, it often just doesn't happen, is my experience. So you'll be part of coordinating any linkages practice, brokering any communication. That's the other thing. Communication between CalWORKS and child welfare at the local level often gets stymied. And so it becomes that person that makes sure that communication is happening, that the protocols are actually working. Protocols aren't working, then you have to step back and redevelop them, rework those protocols. Being able to also, what kind of training, what kind of cross training, what we talked about earlier, it's really important to think about both sides of the house, both programs, both staff in both programs really need to understand the vision. What are you trying to work on? You know, it needs to be really something that folks really understand at that local level. So the coordinator can identify training needs and help guide that. And of course, last on this list, but not least, is champion linkages. And you know, as we said, Roxanne is on this call, and she was one of the local champions in her county. And so that is an important, that's a very important role to keep that at the forefront. Why linkages is important, because as I said earlier, this is not a mandated program. So it's very easy for it to say, oh, it's not important. But when you look at what these two very powerful programs can do together, it is an important practice. So these are some of the things, and this is, again, experience has told us, we've got this wealth of information from all the coordinators we work with through the years. So one of the things they said, that there's so much positive visibility in being a linkages coordinator. They know that, that's, you're somebody out there that wants to, make sure things are running smoothly so it can advance, their career. So we saw a lot of coordinators move on to, management positions. And some of them were program managers already, but felt like they really learned a lot from that cross-program and cross-system collaboration, because I know that when I was and my experiences was in child welfare for almost 30 years, I really didn't know what was happening on that other side of the house, so to speak. That this program really helps the coordinator understand the strength of both programs. And with that, we're gonna give you a chance, 5 minutes, right?
Yeah, I think we're just gonna, I just want to check with Roxanne and Stuart to see if there were any questions or any clarifications that anyone had put into the chat or raised their hand around.
Just a couple.
Yeah, go ahead,
okay.
Roxanne.
This was early on it, and everybody might have already seen this. I'm just gonna review them, but it's just really about how to get the PowerPoint. So Mia will be sending those out to everybody afterwards. And then there was another question around getting this webinar, a recording, where would it be stored later? And Dana shared that in the future, people will be invited if they're linkages coordinators and their teams. And then do we have information about where it will be stored so that people have access to it? I know that Mia will send the recording out, but do we have that information for everybody about where they will be stored?
Yeah, so I think best way to answer it, we're sort of this work in progress. Our toolkit is going to be a very central place in very short order here, where folks can, we're going to drive everybody to help to not only be able to download this type of material, a webinar that we've had, a learning event that we've had, and the associated recordings, but also all kinds of other resource material. So for now, we're not posting any more things on the existing site because we're ready to transition to the new site very shortly. So for now, for just a few weeks, we'll communicate with you as participants in this webinar through email. But as soon as we get it up and running, we'll be posting all this information on that new toolkit. So we'll send out another announcement when that's live and ready to go. So you guys can feel free to to use that and bookmark it on your browser. So thank you, Roxanne, for that. Was there anything, Stuart, that you wanted to add?
No, I just want to make
Or
sure.
Dana?
Yeah, I just want to make sure people are clear that after this is over, we will send to all the registrants the PowerPoint, a link to the recording, and actually the document, the assessment tool that you're going to be sharing in a moment. So everyone will get that right after it. And then in the future, we'll be storing it on the toolkit.
Yeah, thank you, Dana. So why don't we do a little self-care for a moment, you guys? I know we've been sitting for quite a little while. Why don't we take about 5 minutes and just do a little stretch and breathing break, and maybe refill your coffee or water or tea, and we'll come on back at 11 o'clock. Hopefully we've had a chance to stretch and breathe a little bit. And let's go ahead and continue with our webinar this morning. So this next segment, we wanted to talk with you a little bit more about, what does it really take to begin to think through how you want to establish a formal linkages program in your county, or perhaps restart a linkages program that's long since, been not up and running in your location. And so I wanted to again just talk a little bit about what some of you said when you registered in terms of kind of your reason for where you think your program is at this point. And again, we had lots of folks respond to that little question on the registration form about where you think your linkages program is right now. And as you can see, it really matches up with our survey earlier that, these are sort of team responses. So we sort of looked across everybody from one location and looked at how they determined where they currently are with linkages in their location, whether they're, stable, but it's not really countywide, or they're implemented, but not consistently, or maybe it's in place, but you are having some challenges with a partnership, or it's thriving, but it was thriving in the past, but it's lost momentum, and then no formal linkages practice at all. And clearly about 60% of you are in this category, while others of you, may have had it at some time or another or not. And it's interesting too, that oftentimes some members of the same, that are in the same county may have very different views about what their linkages program is, right? Whether it's whether it's not there at all, or there's still some vestiges of linkages going on. So, all of that reflection is really sort of the tip of the iceberg of what is coming next for you guys to really kind of formalize. How do we step back and take a look at where our linkages environment, if you will, really is, right? Because if you have, which most of you do, have no formal linkages program in place at all, then it's really kind of a question of exploring your readiness for beginning that planning process. And there's some of those key elements that you want to sort of take a look at the conditions that are existing in your county, and really make a thoughtful decision about, is this the right time? What are the strengths we can leverage to be able to build a linkages program? What are the kinds of gaps we need to fill to be able to make this a going concern? And so that's really what brings us to this idea of self-assessment, right? Where we wanted to provide folks with a tool where you could really examine your current reality in kind of a systematic way, with those coming together who all have a perspective to bring on that, and be able to collectively interpret those results within your, what we've been dubbing an implementation planning team, really, for linkages. So this is not something you'll want to have a single person in your county trying to be analyzing and launching on their own. You're going to want a collective of folks coming together across both programs that will really help you get a good gauge on that. And so we have created a couple of different tools, and the difference between these two assessment tools is whether or not you already have an existing operating linkages program in your location, or whether you're like many of you who have not started linkages at all yet, or need to restart it. And that's this readiness assessment tool that we'll be talking about in a moment. But once you do that assessment, it's really very much a parallel process to case planning, right? Where once you sort of understand your starting point, where you are, what are some of those strengths and what are some of those needs programmatically for you to get this on the ground, all of that information then will help inform a work plan development process, right? So that you can really identify some critical priorities to address, define what success looks like for your linkages program, understand, what families you want to target to serve, and the way that you want to serve them with a collaborative effort using your relationships between CalWORKS and Child Welfare Services staff. And most importantly, to build the program itself and get it off the ground and develop those protocols so that your staff know what to do, and test them out perhaps in a unit or two to make sure you've worked the bugs out before you roll them out to a full division or office. You'll want to, map out what are the steps and tasks to get us there, and be able to delegate that work amongst a body of folks, so that you're really building ownership as you not only assess your conditions that will inform your linkages program, but also you're developing a work plan to get those protocols in place. And we have a template for that as well that we're going to offer up to you a little bit later down the road. But today we're just going to focus on this first step of doing your self-assessment, using the readiness assessment tool to do that, because you're kind of newer counties to linkages. And then about a little more than a month from now, we are going to host another webinar on April 19th from 10 to 12 p.m. 10 a.m. to 12 p.m. And we're going to focus exclusively on the work planning process at that webinar, right? So today we're really going to focus on this first step and get you familiar with the kinds of questions that you want to ask yourselves to really get ready for the kinds of programmatic development that you want to be doing to get linkages going in your location. So with that, I want to be able to share with you and just kind of walk through this readiness assessment tool for linkages. And we've done a little bit of revamping of it. For those of you that may have touched on linkages in the past, we really have taken more of a prevention focus to it. And so with that, I want to go ahead and stop sharing my screen, and we're going to flip out to the tool itself. And I think Mia is going to bring that up for me by sharing her screen. And there we go. Thank you so much, Mia. So we'll make that as big as we can for us with aging eyes. And so this is the tool. It's really a simple kind of series of questions that you can ask yourselves as an implementation team. It's designed to be completed, in partnership, right? So your CalWORKS folks, your child welfare folks who are part of your implementation team, which we always like to suggest, should be a relatively small set of folks, right? That begin to do some of the planning and thinking about how you're going to get linkages going in your location, 10, 12 people. If you're a larger county, you could have up to 15 or 20 people. But the idea with this is that, and if you can scroll down just a little bit, Mia, you're going to ask yourselves a series, there's 12 questions on this assessment tool, and they're all sort of stated in the affirmative, right? And then there's a scale underneath so that you can really kind of rate yourselves on whether that element is, completely happening in your location or not at all. right? Which would be a 1 on the scale. A 5 would be, yes, we're completely on top of that item, right? And then there's a few choices in between as well. So it's a gradation of how much you agree with that statement, if you will, in each of these questions. So let's go ahead and go through we go through the questions one by one. So let's start at the top, Mia. And so, it kind of follows those key ingredients that we went over earlier, right? And this first one has to do with, we have a strong history of child welfare services and CalWORKS working together successfully on other collaborative initiatives. So that's kind of getting at, what is the what is the history of you guys working together, right, on other collaborative initiatives? This could be, maybe you guys are all familiar with one another through the AB 2083, system of care work that you've been doing or something like that. Or maybe you're all involved together in the Family First Prevention Services Act planning in your county or something like that. So you'd be able to sort of sit back and reflect on that question. And just as an aside, another thing we like to suggest just to get people familiar and really thinking about this is it's sometimes good to send this tool out to folks individually first and have them kind of write down their own impression of what they think individually as an individual member of your implementation team. And then you come together with your scores and you come up with this consensus score. So that's a nice way to have people think through it really deliberately and then come prepared to dialogue and kind of reach consensus about each of these. Because just like with the question on the registration of where is your linkages program right now, there's often divergence on that. There can be differences of opinion about these questions too. And I see a question about, will we get this tool? Absolutely. Yes, this tool will go out with the PowerPoint. So you can have that as a companion document. And I want to say too, it's a Word document. It's not a PDF. So, if you see an additional question you want to add or something like that to this, feel free to make it your own. Again, Linkages is something you want to customize, but you definitely want to answer these 12 questions at least, right? So the next question has to do with leadership, right? And it says the leadership of both Child Welfare Services and CalWORKS see the value of pursuing a continuum of services for vulnerable families with a focus on prevention and early intervention. So that's that idea that, we're all kind of thinking through how to conceive of linkages now as not just a tertiary collaborative program, but one that can really help early on in folks' in folks' experience with families, that we're really reaching out with our partnership to families as early as possible, even before they might become a case. Certainly on the child welfare side, anyway. The third question has to do with your leadership, right? Are they modeling commitment, right, to some of the fundamental values, if you will, of linkages: collaboration, engagement, teaming, advocacy, through the ability of linkages to be able to reflect those values. And again, you guys, may be becoming more familiar with these kinds of values in all of your locations with the advent of the integrated core practice model in California and those sorts of things, as well as the CalOR work that's happening in CalWORKS side. So Mia, go ahead and scroll down to the next 3 or so questions and we'll take a look at those. And again, here's a question about, is there a shared understanding in our county regarding the connection between poverty and child maltreatment? So that's still the fundamental core of linkages, right? That we understand this intersection between, economic challenge for families and child safety for families at the same time. And so we want to definitely have awareness around that. And again, if you it goes on to talk more about kind of your organizational priorities, right? In terms of, is service coordination between Child Welfare Services and CalWORKS a priority, and are you utilizing, perhaps the child and family teams as a way, or another teaming model, if you will, to really create the forum for that collaboration to occur, right? And that seems like an obvious question, but it's interesting. You know, the real crux here is CalWORKS at the table, right? For some of these teaming environments that we've so now closely established into our case planning cycles, right? A lot of times we think about mental health providers and community-based organizations and other folks, but are we definitely deliberately bringing CalWORKS to the table when that makes sense for a family? And then number 6, scroll down a little bit more for me, Mia, if you can. You know, this question has to do about, you know, thinking through a coordinated services model, right? And so are the goals for child welfare services and CalWORKS, are they advanced, kind of at least in a balanced way by Linkages? Is this a program that CalWORKS sees as valuable for advancing their programmatic goals of you know, building family resiliency and you know, supporting the economic self-sufficiency of families, equally as child welfare side is seeing it as a good program to advance the goals of child safety and family well-being as well. It's really helpful for that to be a balanced perspective. Otherwise, it creates strains on the partnership sometimes. So let's go to the last sort of page of questions here. Thank you, Mia. And so, and again, this is again kind of about the nature of the partnership that exists right now in your, or the conditions for partnership, I should say, in your county, right? That our management staff and partners on both sides of the aisle committed to working together, right, for the purpose of meeting families' needs, right? That might be expressed in an MOU already, in your 2083 system of care MOU or some other vehicle. But even if it's not documented there, is there at least the spirit of that present within your county as a precursor to this? Then we go on to talk more about kind of the organizational readiness in terms of systems and the environment. And this question 9 is about are the data management divisions or units on CalWORKS and child welfare have the capacity, right, to support the operations and evaluation of linkages, right? And that's everything from being able to use data to support you identifying new clients or tracking outcomes, or being able to reach out and support implementation in other ways. And then same with the training divisions. Do you have capacity to support some of those joint training opportunities that we talked about earlier? And then finally, I think we've got the last couple of questions, if you want to scroll down, 11 and 12. And again, these talk about the organizational culture and leadership being able to allow the time, energy, and resources to sustain the Linkages partnership over time. So again, it's another way of looking at that leadership commitment to Linkages. And then finally, are you all willing to establish the dedicated kind of role that Dana talked about? This is really the Linkages coordinator role here within both CalWORKS and Child Welfare Services to coordinate the sort of daily operations of the Linkages program. It is important to have kind of that point of contact, that person to troubleshoot any kind of collaboration issues and really just champion the Linkages effort over time. So, you know, a dozen simple questions gives you a chance to rate it, you know, from 1 to 5. And then once you scroll down a little bit further, there's some concluding section here on sort of what do you do now that you have your consensus ratings on all of those questions. One way to just think about this, obviously reflect on step back, what does that tell us? Where are our strong points? Where are the areas that we want to work on developing a little farther to begin to prepare for Linkages? But a simple way to sort of step back and think about this is just to add up the numeric value that goes with each of your scores, and be able to add that up to a total score. And that kind of gives you an index, if you will, of kind of where are we, right? If we're in this sort of 12 to 30 level, we're more in the 1s and 2s on most of the items, right? That helps you know where your time and energy and planning attention needs to go, right? It doesn't necessarily mean that you shouldn't do linkages, right? That could be a decision you make, but it helps you reflect on what's it going to take for us to get some of these readiness elements from a 1 or 2 up to maybe a 3 or a 4 as we begin to prepare and plan for this, so that we have the kind of support and preconditions for linkages to be successful in place. A lot of you will probably fall somewhere in the middle here, the 31 to 47 kind of total score range. And that's, again, where some things will be strengths, some things will be growing edges, and you can really use that to think about where do we want to start and how do we want to maybe use some of those strengths to actually help move this process forward, right? Like, for example, if your leadership is really invested in this on both sides, you can really use that alliance to really help build up some of these other areas of sponsoring some, joint planning sessions together to design what linkages needs to look like in your location, and then subsequently to train staff on that. So if you're in the upper range and you're hitting all 5s on all of this, you're pretty much ready to start planning, right? And you've got a great foundation to build off of, and you'll be able to, begin to sit down and think about, okay, what now do we want our linkages program to start to look like? Okay. So with that, as we sort of switch back, before we switch back to the slides, I want to pause here. I see a bunch of numbers in the chat here that have accumulated. I wonder if I can check in with Roxanne and Stuart and see if there's any questions that we need to respond to before we move on.
Well, there's one test question that's related to the tool, and it's about who they should be partnering with. So the question was, who does Children's Services partner with? And so my response was just kind of more general, like, the group will identify their target population and their goals, and then through that identify their stakeholders and who it makes sense to partner with. But I wonder if you want to expand on that question, Leslie Ann or David.
Yeah, absolutely. And I'm wondering if this person means who to partner with to complete the tool itself, or who to partner with to create your linkages program.
I mean, I think it's about both. I think it's
okay.
both.
So let me start with the tool, and we are going to actually move on and talk about that in just a minute in a lot more detail. But you're going to want to bring people together who have a perspective on either what this collaboration could mean, how it could benefit people. So this would be folks that know the CalWORKS program in your location, folks that know the child welfare program in your location. You might want to do some early thinking. Okay, so this is a clarification. Who do we partner with aside from the tool? Yeah, so that all depends on the design of your linkages program, right? And that's why, and we're going to talk lots more about that in the work planning process. But one of the things that really drives that, as Roxanne said, is who your target population is that you want to serve with your linkages program, right? And so once you know that, like, for example, I've worked with counties before who have done some early intervention types of work. And so they brought together, some program managers from the emergency response side on the child welfare program. And then what they were recognizing is that there was opportunities when those families were eligible for CalWORKS to bring together knowledgeable people on the welfare work side, right? Who could come, or for example, perhaps you're looking at that family stabilization program in CalWORKS coming together very early on with your emergency response referrals. And so you're going to want to get those people knowledgeable about those program areas to come together and say, what's our opportunity here to really make sure, right, that those folks are bringing the kinds of resources together, what's our opportunity to connect them into our teaming process logistically? You know, how do we make sure families are aware of this opportunity to be able to take advantage of those resources? What's our teaming environment look like? So all of those things would be important to then think about. That's who we want to sort of bring to the table to help us design that. So,
I
yeah.
just wanted to add
And
to
Leslie,
that.
and there's,
Go
oh,
ahead.
go ahead.
No,
No,
I
there's
just
a
wanted to
follow-up.
add that if you know, as we work, you know, there was a question about welfare to work. No, we are, welfare to work was really the focus of our first iteration. And it's not that that's going away, because we think that it's very important. If you're working, your focus is going to be with family maintenance and family reunification, and there's an open case that has welfare to work requirements. However, it's much broader than that. So I think if you're, you know, as you start this program, I think you need to, you know, your CalWORKS, and I'm not sure how, you know, everybody's organized a little different, but whoever is in charge of your CalWORKS program, somebody under them that has both payment and some of those other programs like family stabilization, home visiting, because those are all the early intervention kinds of programs that really support families. And so that may be who you want to be.
Absolutely.
Beginning
Yeah.
as you do your assessment. You might narrow it down and say, no, we really want to start with our family maintenance cases on the child welfare side, you know, but that, as Roxanne put in, I think, the chat, that really will depend on how you assess your organization and that population you think you would like to start with or reinvigorate, because some of you already had a program. You know, is there something there that you want to rescue and start because you already have folks that were committed, but there just wasn't enough support for this work?
And, you know, I want to suggest too that one of the ways that I think would be really effective for you guys to help determine what that direction needs to be is to make sure that you sit down and you do like kind of an information exchange, if you will, like a knowledge exchange, right? Because one of the most sort of incredible things that we've learned over the years with linkages is just how much CalWORKS and the whole world of, you know, that side has to offer families in terms of support, right? And so when you sit down and really familiarize yourselves with each other's resources and programs and who can benefit from what things, that will help inform you when you take a look at your service population to say, well, which families then could benefit most, right, from this kind of working together and collaborative arrangement that we want to try and design here. So I think that step, as Dana said, there's so many new things that are happening on the CalWORKS side in this broader look at linkages that we're trying to expand beyond just common cases to mutual families, right, that we may encounter at a point in time when they're very vulnerable, and we can bring together resources at various stages, right? So, and I know you guys are eager for that kind of example information, and I want to really promise you that in that work planning webinar, we're going to lift up many more examples of linkages protocols that I think will help illustrate this for you, of what are the types of what I always call flavors of linkages, right, that can be developed out there, and particularly with a prevention focus now that we're wanting to emphasize that.
So
I'm going to go ahead and go ahead, Stuart. You had a comment.
Yeah, there are a couple of things in the chat, and we've responded to them, but just to put a point on it for everybody if they're not watching the chat. Question about whether we would be expecting more policy guidance from CDSS, and I just replied, because it's a voluntary program, it's more likely that the guidance really will come out of the project itself rather than, there may be some things. So the Prevention Early Intervention Committee yesterday was talking about developing some tools that we would like the department to issue as all county information notices. But you're not likely to see anything like an ACL because, again, it's a voluntary program. But the wonderful thing about working with CDSS champions is we'll work hand in glove with them. So to the extent that it's relevant to come out as policy guidance, we'll work with them to do that. The other question was about about the availability of case management tools. And I know, there's so much that's already on our existing website, and we'll be migrating that to our new website in the very near future. So yes, there are a lot of materials and tools that are available to folks already. And the purpose of the toolkit, the website, is that as we develop those, we make them available to everybody.
Yeah, and just to add, I mean, this is really a peer-to-peer sharing kind of, program in many ways too, where what Roxanne's been doing a wonderful job over the last several months of just kind of gathering some of the latest policies and protocols from different counties, their descriptions of their linkages protocols, so that we have all that information that will add to the toolkit, so that it's not so much directives from the state about how to do it and build your own program. You're looking at your peers and saying, oh, we could do that, something like that here too. And then you can sort of adapt and be able to modify and use those examples to help build your own linkages response.
And I kind of like to respond. There's two questions in there really about evaluation and data. And I want to talk a little bit about that. We do have an evaluation subcommittee that will be part of this new iteration, because part of what we want to do is to do a better job of evaluation. We do have an evaluation on our website now of the last, of the previous linkages iteration, but it does not, of course, have anything around, the question was, do we have anything around disproportionality in African-American families? We don't have that. And at this point in time, we're really trying our best to think about how best to evaluate this program. And when we get up and running, part of what we'll be asking you to do and think about is, your own logic model, which will say, what are you trying to do? And what's the data you're going to collect in order to show that it's been successful? And I would certainly hope that we can create part of the evaluation to look at disproportionality and the impact. Do we have better outcomes for children of color and families of color when they're part of the linkages project? So that is more to come. And there won't be any state reporting requirements, because as Stuart mentioned, and we've mentioned, this is a voluntary, it's not a requirement. But if you're going to be part of the project, we will be asking you to think about how you will be evaluating your program and what we can do at the project to support that evaluation. I think that's all. Stuart, I don't know if you want to add anything. I know that's part of what we're looking forward to as we get more funding for the project, if we can actually hire an actual evaluator to help with that.
Yeah, that's good. So,
Right.
Let's Leanne get back to moving us forward.
Okay. Mia, thank you so much for sharing your screen. I'm going to reshare mine again. And oh dear. Okay. There we go. Okay. Can you all see that? It looks like a tool out there still. Okay. Great. So just to segue, I think our first question was related to who participates, right? And I think I kind of alluded to it, but this kind of, we can recap, right? Who do you want to bring together to really contribute to your self-assessment process? And that will likely, transition into the team that helps you develop your planning process for how are we going to design and launch our linkages program in our location. And so we really want to, have you bring together people who are either knowledgeable about linkages already, certainly, if that's a reality for you guys, but in lieu of that, are knowledgeable about the two separate programs and their services to the vulnerable families that you believe, definitely are ones that that could benefit from this kind of coordination. Typically, you want to put your, get your linkages coordinator type of individuals in a role here, even if it's temporary for the planning process, and you may shift to some other person holding that role once you get up and running. It's really important to have a point person here to help guide your planning and design process. And then, certainly staff who have served the types of families that you believe who might be able to benefit from this kind of an approach, right? Whether those are, for example, families that are, coming to your child welfare referral door over and over and over again, but aren't necessarily rising to the level of a full-blown case, but you're clearly seeing the kind of vulnerability that's happening. Even knowing, who your CalWORKS families are, who may have had some experience in the child welfare system at some time or another, right, is important, and who works with those families, right? Maybe parent partners or others who have lived experience with this, folks who've been involved at some point in time, maybe not simultaneously, but over the course of their service experience, have had exposure to both child welfare services and CalWORKS. Obviously, supervisors or managers who are focused on prevention work, right? And some of the other programs that, that really support family home visiting, homeless services, those sorts of experiences are very helpful to think through how we can leverage these resources of these two programs. Again, some of the ancillary staff that will really support this effort going forward, your trainer staff, your data analysts, if you have evaluation staff locally that understands your data and can bring some of that forward, even fiscal staff, right, about sharing costs, between programs, they may have a perspective to contribute as well. So the point is, multiple voices really will help, get you that sort of 360 view, if you will, of your strengths around readiness to embark on planning for a linkages program, and where your growing edges might be with respect to that as well. So, in addition to, that simple scoring sort of conclusion piece that we looked at in the tool itself, there's some core questions that you'll want to ask yourselves too, just as you reflect on the findings from completing your self-assessment, right? Really step back and ask yourselves, what do we make of how we rated ourselves in these various dimensions of what's important for our linkages program, and where do you think where does this really reveal our core strengths and areas that may need some attention as we begin to think about whether we want to embark on this or not, and then what factors might be contributing, right, to if there's issues around, silos, for example, between the two programs or something like that. What are those gaps, and how far away is that from where you want to be in the future? What might it take to develop some of those sort of precursor readiness factors a little bit better? And what are the ways that you want to focus your linkages program design based on your assessment findings? So what does that begin to tell you about the kinds of families that might be able to benefit from that kind of collaborative effort across the programs? So let me talk about then kind of your task going forward, again, should you choose to accept it. But if this is sounding like something appealing to all of you, and hopefully it does, because you're here anyway to see the value of all this. But really the first step is to identify those linkages coordinator roles, right? Who's really taking the lead? And maybe some of you that are here today listening to the information and background, but get those folks in place so you have that sort of core partnership, at least between the linkages coordinators, to begin to move this forward. And then identify and gather a linkages implementation team. One of the things we are also going to do following this webinar is we're going to send your county a list of who all registered for either this webinar. Some of you even went to the webinar earlier this week from these same counties too. So we're going to give you a list of that total list. And so that's also sort of a starting point of who may be important players to consider as you begin to establish your implementation team. And then we're hoping that should you choose to go forward with this, that you would go ahead and complete the readiness assessment with your implementation team by April 19th, when we'll have that work planning webinar ready for you. And that's when we'll sort of you can have those findings in your mind as we move further into how do you really go from there to develop what you want your linkages program to look like. And then we'd hope that you would register and participate in that work planning webinar. We're going to try and get the registration out for this webinar like next week sometime. So shortly after we send you the materials from this, we'll be able to send that registration link to our folks that we know have shown interest here as well. So again, that'll be on the 19th. We'll focus deeply on, this work planning template. It's a very simple template, very adaptable. Again, really help you walk through what are the elements that we need to decide about. We have kind of a roadmap that we also accompany with that'll help you think through what are the key decisions we need to make, and also to draw from examples from other counties of what that might look like as you think about the various kinds of protocols that you might want to design for your CalWORKS and Child Welfare Services working together to benefit families. So we want to pause here then, and I see more activity in the chat. If there are questions at this point that we want to lift up that have already been answered and reiterate for everyone, or new questions that we need to answer at this point. Anything out there, Roxanne?
Yeah, so there's a question about eligibility staff, and definitely, all, all CalWORKS and eligibility staff are important partners. I don't know if you want to say that more about that related to, how it links to their assessment and their target population.
Absolutely. And, I think this is, again, I think we're still shifting our language, right? As we've gone from linkages 1.0 to 2.0. When we say CalWORKS, we're thinking about that as a collective noun, right? Of all the roles within the income assistance and economic self-sufficiency side of the programs, because, and particularly as we move toward these early intervention and prevention areas of focus, I think there's real opportunities, right, for eligibility staff to be aware of linkages, right? I know in some counties, they have been pursuing strategies for linkages that, for example, when Child Welfare Services goes out and encounters a family they've received a call on, and they notice and recognize that the family may be in need of income support, or, definitely poverty is an issue for that family, and they are not yet involved in, have never applied for benefits. Some counties have developed kind of an expedited process where those families that have been shown to be, brought to the attention of the child welfare system sort of get an expedited eligibility process through the CalWORKS system, where they can more quickly and easily determine eligibility and get benefits into that family as quickly as possible, so that that's part of that collaboration that helps make that connection, right? For a family who is not on CalWORKS but should be, and that's one of the factors that will help keep that family safe and stable over time, especially if that case is not rising to the level of necessarily having an open case on the child welfare side. We want to leave that family better than how we discovered them, and be able to connect them to as many resources as we possibly can. So that's a great example of a connection with eligibility and child welfare services. Dana?
I just kind of wanted to respond to thinking about that in terms of that question about who should be doing this assessment, especially since there's so many other programs there used to be. However, even in the past, what we did, because I can remember this myself when I was a child welfare director, sometimes you start at the very top. Sometimes it might be those two whatever they're called, deputies. Some of them call them child welfare directors, self-sufficiency directors. Sometimes we started there for those two folks and their lead folks to think about that assessment. Where do they want it to go in their county? So you might consider that it be at that highest level doing that first assessment. Now that may not be the ongoing team, but until they decide, for example, I had a lot of connection with the deputy levels until they kind of drilled down, and then they assigned it to a program manager level, and in some places even a supervisor or an analyst level that was over those programs. So I think for those of you starting off, you might think and ask your deputies to think about this. Where do they want this program, or do they want this program? Because it really needs to be supported by upper management. And because if upper management doesn't support it, it's not going to go anywhere. That's the other thing we also learned in our work. Because right now, and there was a question around funding. At this point, there isn't additional funding for this activity because it's really seen as sort of a collaborative practice, because you already have folks that are doing emergency response, or you have a worker in child welfare doing family maintenance or family reunification. Or in the CalWORKS side of the house, you might have somebody, you have workers that are working intensive case management. You might be contracting that out, or family stabilization. So you already have folks that are doing the work. So this is designed to think about how you do better collaboration between whatever parts of the program you decide is going to be your target population, and it may change over time. You may start with one area and you may then move to another. So I think the flexibility in how it's designed is one of its strengths, but because it is not mandated, there isn't particular funding. That being said, County Welfare Directors Association, CWDA, actually had a proposal for funding that did not get approved by or did not get supported by the directors at this time, which is something that we hope to bring forward again, maybe in next year. But at this time, we have no specific funding. It's really about best practices, how you leverage resources between these programs, and how you coordinate and collaborate around your existing workforce. I hope that answers your question.
Mm-hmm.
That's a couple of other questions. There's one about somebody wanted a link to the website. So I think we said we're going to have the new website up soon. I don't know if we want to put a link to the new website, to the old website in the chat, or kind of probably not at this point.
No, we're hoping by our April 19th, we're working with our web developers, and we actually had hoped that it would have been up by this meeting, but it's not. But we're definitely got a target date by our April 19th work planning that we will have the new toolkit up, and in that we will migrate over existing protocols from the counties that have been updating. As we said, Roxanne has been reaching out, so we're getting updated protocols from existing counties we'll put in there. We don't have a lot around prevention and early intervention because that's the part we're going to build out as we move forward together.
And then question for new counties, what does the program entail? Do current counties use social workers to provide case management, or what are best practices?
So that's a great question. I saw that question, and you know, I think what's important is thinking about, you know, the type of linkages program that you want to launch, right? And so I think the collaboration does definitely often occur between, if you're doing a tertiary kind of collaboration, that is, you have an open case on both sides, right? You're typically doing that collaboration with the case carrying worker on the child welfare side and the case manager, case carrying individual on the CalWORKS side, typically is what that often is. There are other models that counties sometimes use where they may have a co-located CalWORKS, you know, expert or advisor, if you will, that provides collaboration to several caseworkers at key points in time in the development of that family's plan. So that's another way to collaborate. But oftentimes you really do need that knowledge base of what's happening for this family. What are these families' goals, right? What are their service needs, and how can we collaborate better to make sure that we're leveraging everything we can, we're not duplicating efforts for that family, right? And we're aligning their goals and streamlining their goals in such a way that it's not overwhelming for the family themselves. So, you know, we have some strategies in place for that sort of thing. And as Dana said, we're doing more experimentation now with the kinds of strategies of collaboration we can apply when we're not that deep into involvement in a dual way in both systems, right? Perhaps this is a family who, you know, is just new to CalWORKS or isn't open on the child welfare side and won't be, but there's still some kind of resource connection we can make for that family at a point in time when we encounter them.
I think it's helpful to note, people may be thinking there is a linkages worker, that these families that are in both systems, you would have a worker serving them both. And it really, as Leslie Ann said, it's more about the collaboration. Those counties that have dedicated linkages staff, it's one person who is a go-between, a facilitator, but you still have your independent caseloads in CalWORKS and child welfare. So it's, again, sort of understanding the model that way. Bunch of questions just keep coming up. One about where do we track cases? I don't know that, you know, at this point we might want to just kind of collect the questions and let people know we'll get back out to them. It's a complicated question about tracking.
Yes.
We've had issues around interoperability because we want to track families who are in both systems. So maybe that's something that we get back out to people. Question about confidentiality. Whether CalWORKS staff attend CFTs.
Yeah, well, we can answer some of those, Stuart, because it depends upon the model. For example, that question about CFTs, there are some counties, yes, they invite the CalWORKS worker to the CFT. And of course, the child and family team, for those that are in CalWORKS may not know what that is. And that is required for child welfare to have a child and family team. And depending upon what your protocols and how you develop your program, your eligibility work or whoever's the designated linkages person would be invited because they know the resources the program can offer that family. And there are counties now out of the Linkages 1.0 that has somebody on the CalWORKS side attending those CFTs, or they're still calling them, some counties are still calling that first one a team decision making, a TDM, because they really aren't looking at a case so much as trying to figure out, is there resources we can put in to keep the child from even coming, for us filing on. So yeah, there are, there's confidential, we have examples of some confidentiality protocols that counties have developed between programs.
So the nature of all of your fabulous questions is making me think that we want to make sure that as we approach our next webinar on April 19th, that we're weaving in some examples of linkages protocols throughout that session, so that you all who are relatively new to linkages can really sort of see what we mean by some of these examples, right? So that you can envision, because this is the hardest thing I think to grasp about linkages, is that it's not a mandate. It's not you go to this manual and here's the 7 steps to create a linkages program. It's a very creative process, and there's power in that, right? Because you're really targeting it to the families in your location that are in need, and the configuration of how your office works. The challenge of it is that it takes a little more, of your thinking caps going on to design that in a way that works for your location. So we're going to put that in our own planning bucket here as we go to design the webinar for April 19th, and bear in mind that I think that'll be very helpful for you guys to see those examples.
And the question regarding, no, you don't have the information out on the April 19th yet. We didn't want to confuse everybody until after we got this webinar completed, and you should get that next week, right?
A registration.
It'll go out next week. Last time it went out via the Children's Committee and the Self-Sufficiency Committee. And we can we'll decide whether or not it just goes out to this whole list as well, because I'm not sure if this whole group will be on or if the county feels like that's beneficial for them to have everybody on the next one, when we're going to be talking a little more detailed about the work plan. But you all can make that decision. I mean, we can send it out to this whole list as well as through the committees.
Okay, sounds good.
Anybody else? Did we miss anything, Roxanne, Stuart?
No, I don't think so. I think we got everything. I think the only thing that I'll just mention that there was a specifically mentioned CalSAWS, and I know that each county's doing their own programs differently, but I know that sometimes CalSAWS is involved, CARES is involved, CWSCMS, but again, it just varies from county to county. Yeah,
and the question about, would this be additional cost for counties, any programming? I mean, we've been talking to the CARES program about trying to put some indicator in there that they could capture, when there is a mutual family on the child welfare side. The SAWS side, I'm not sure. So we've got a work group looking at that, but that is a real challenge. For the most part, I will tell you that counties have created tracking lists. They've, data matching through different systems. I think Crystal was one of them, and to actually track their families. So that is a challenge. We would agree. So what's the next steps before the 19th? We've just got a few minutes left, but we want you to identify linkages coordinators or point of contacts from both the child welfare and the CalWORKS sides, and for very small counties, if that's one person, there's my email up there, just get to me, let me know. Establish your team, your implementation team, at least for you to think about, who do I want? Where do we think we're going to begin in our county? Who do I want on that implementation team? Really complete your readiness tool. We would hope with that implementation team, but as I said, it may be that you're going to be completing that readiness tool with your upper management and whomever they designate, as they want to think about in their county, your county, where do we want to begin? What do we want to do? And then what you'll see, Leslie Ann, did you have something you?
No, I just wanted to say, please don't worry about that second to the last step. That should not be on that slide.
Yeah, we should.
So
That'll be
sorry.
off when you get the PowerPoint slides, because we're not
Yeah.
going to ask you to do that, because we thought, yeah, until you see the
It's
work
too
plan,
much. Yeah.
it's too much. All we
Yeah.
want you to do is do the readiness tool and not worry about the work plan until next time when you come to the 19th. Really have your assessment done, and you can be thinking about and tell us, what are you all thinking about in terms of where you want your program to go? What's the goal of your program? But we'll go into that a little more depth on the 19th. But the real thing is really getting your point of contact, your coordinators, so that we can reach out to them, who is going to be on your team, and completing that readiness assessment tool. And then next week, when we get out the registration flyer, register who you want to be on that, because we were really hoping that we could actually have the teams come to that one, so that you would know from your county who is coming. So we're going to be really asking the point of contact to register the team.
Mhm.
So any questions about that? Otherwise, we've got 1 minute before 12, and I know you're all hungry. Any last questions for the chat?
I just like to, I just want to say, there are a lot of unknowns. It sounds like it may be a daunting thing, and you might be thinking, wait, this is way too much to do, but it's such a rewarding program. And if you talk to the counties that have been sustaining their linkages programs, it is so rewarding for the clients, for the families who get support, coordinated support from two very large programs that they're participating in, and it's rewarding for the staff. We've got some of our old videos where we've done so. Don't be put off by the unknowns. The goal of the project is to guide you through it. Unlike a lot of things where we just send you a manual and say good luck, the Linkages project is really there to hold your hand throughout the process. And Leslie Ann, Roxanne, Dana are there for you to help you. So we're hoping everybody is excited and encouraged by this. And we look forward to seeing you on the 19th.
And yes, we will share videos and success stories as soon as we can get those up on our new toolkit.
Okay, and we will send this material out to you guys so you can discuss it further with your teams, and we look forward to seeing you in April.
Yeah, great. Thank you. Thank you all for your attention.